Welcome back to Therani, I'm Joe B. Do you struggle as to which joint mobilization techniques to provide first to your patient, as well as how to progress it every session? If so, then I hope this video gives you some clarity. Let's dive in. So there are three joint mobilization categories that you commonly use in the outpatient setting. These are muscle energy techniques, your non-thrust mobilization techniques, and finally your high velocity, low amplitude thrust or your thrust techniques. To elevate your skills as a physical therapist, you need to carefully progress your joint mobilizations from muscle energy techniques to non-thrust mobilization techniques and then to thrust techniques. As a physical therapist or physical therapy assistant, just like in providing exercise in a gradual manner, you need to err on the side of caution when providing these joint mobilization techniques, as this establishes a good sense of understanding and trust from your patient. When they see that you are careful with these techniques and not just take their joints up to the end range right off the bat to flare up their symptoms. In addition, most of these patients aren't going to allow you to take their joints to the end range just like that. So these patients are actually pretty guarded. You definitely want to use that particular muscle guarding to your advantage in order to move their joints. Hence, you want to start with a muscle energy technique. Let's take your patient, for example, with a known limited rotation to the right because of an L4 extended, side bent, and rotated to the left vertebrae. Position your patient in left side lying first with the rest of her joints above the spot you want to mobilize to all be side bent and rotated to the right side. As you can see, the upper torso above the L4 is side bent to the right and rotated to the right. You will then be in front of the patient with your right forearm leaning against the right anterior shoulder while the left hand pulls the ilium to the left to get the patient to tolerable end range first and take up the slack. Once there, use the patient's muscle guarding by having her rotate to the left against your resistance and hold it for 6 to 7 seconds. This will cause her muscles to contract, and following the principle of autogenic inhibition, any muscle contracting will have an equal relaxation phase afterwards. Kind of like the law of physics, that in any action there will be an equal and opposite reaction. This will allow you to rotate her trunk to the right further to gain more range and repeat 3 to 5 reps. After like 1 to 2 sessions of this, and once you've started gaining your patient's understanding and trust, then by the 3rd and 4th sessions, you can progress to non-thrust mobilization technique. Position the patient and yourself the same and take her trunk to mid-range rotation by taking up the slack as tolerated for grade 2 mobilization. From there, you ask the patient to breathe, and during the exhalation phase, you rotate further as tolerated to get to grade 3 mobilization or up to the limit of the range. You can hold this particular position for 30 seconds. After that, ask the patient to breathe one more time, and during that exhalation phase, take her trunk to grade 4 mobilization range or at the limit of the range, and hold for another 30 seconds. You can even provide oscillation for 30 reps as you get to either grade 3 or 4 ranges, as that can optimize your patient's pain relief. Once you get your patient to grade 2 mobilization range, you can already provide joint oscillations there for 30 reps. During the non-thrust mobilization phase, do observe your patient's muscle guarding, because if it is worsening, then it's probably better to revert back to muscle energy techniques. But if the muscle guarding is getting better, then you can go ahead and progress further into grade 3 or 4 of the mobilization range and eventually to thrust techniques. By the 5th and 6th sessions and onwards, then you can advance to high velocity, low amplitude thrust or thrust manipulation, or also called thrust articulation. Position the patient and yourself the same and take her trunk to grade 4 mobilization or at the limit of the range. From there, you can deliver a high velocity, low amplitude thrust or a quick end range thrust. With this technique, you may feel a pop in her spine or a joint cavitation. A cavitation is basically when the nitrogen inside the joint comes out of the joint, resulting to a matter change from liquid to gas, represented by a popping sound. There you have it. To elevate your mobilization skills and have better patient satisfaction or outcomes, you have to think muscle energy techniques first, then non-thrust mobilization, then high velocity, low amplitude thrust manipulations. So let me know in the comment section below if this way of thinking has helped you with your patients. If you like this video, please like, share, and comment. And for more therapy animations, please subscribe to Therani.